Dr. Murphy presents questions and answers about the mommy makeover.
So I'm Dr. Terry Murphy. I'm a plastic surgeon. I'm certified by the American Board of Plastic Surgery. And I see a lot of patients here in my Englewood, Colorado office who want to reverse the effects that pregnancy has had on their body with procedures known as a mommy makeover. I see many patients in my practice who come in because they want to reverse the effects that pregnancy has had on their body. And if you talk to any lady who's had a number of pregnancies, she'll talk about her breast and she'll talk about her abdomen. There are various effects and things the way your body changes over time that you can work on yourself. You can do exercising, you can lose weight, you can take care of your body and make things look better, but things happen to your body, especially in your breast and your abdomen during pregnancy, that patients have difficulty overcoming, and those are the kind of patients that I see who are requesting surgical procedures.
What are the effects of pregnancy on the breasts?
There are a number of effects on the breast related to pregnancy. Stretching of the skin is common. You'll see patients with stretch marks and loss of volume. A lot of patients will tell me that they breastfed their babies and therefore that led to loss of volume in their breasts. But it's interesting, there's a number of studies, one more recently which came out, that have shown that it's really primarily the effect of the pregnancy, not the breastfeeding, which causes the involution and loss of tissue in the breast. These patients will have laxity of skin a lot of times, they've lost volume. Some patients require a breast lift. Most of them require a breast augmentation or a breast implant. Although most of these patients, I think, will benefit from a breast implant. They want rounder, fuller breasts. Some do require a breast lift or would look better with a breast lift. Most patients who come in and think they need a breast lift do. Over time, as they develop laxity of the skin, the nipple can come down a little lower on their chest, and a breast lift will do a combination of elevating the nipple into position and tightening up skin. So commonly we do breast implants, either with or without a breast lift. We are fortunate these days to have many different choices as far as implants. Obviously they come in many different sizes, and we spend a lot of time doing sizing, making sure that this implant the patient is selecting fits their body and looks natural and they're happy with the size. We think about the width of the implant, making sure that there's medial fullness without being too wide, so we can use different profiles such as moderate profile, high profile. And we talk about different breast fillers, breast implant fillers. We most commonly use silicone, especially in patients who've lost volume and where a saline implant might look and feel a little less natural. The silicone implants look and feel more natural and achieve a better shape inside her breast without a lot of natural breast tissue.
What are the effects of pregnancy on the abdomen?
Of course, pregnancy has many effects on the abdomen. The skin gets stretched, it can lose elasticity. So most of these patients have a degree of loose skin. Also, the muscle or the fibrous layer overlying the muscle gets stretched. The rectus muscles go up and down in the middle, and when you do sit-ups, you can tighten those up. But with pregnancy, the muscles split, and in between, it's replaced with a fibrous tissue. And no matter how many sit-ups you do, you can't decrease the width in that area, and that leads to laxity of the muscle wall. So when we assess patients who have had pregnancy and are concerned about how their abdomen looks, we think in layers: skin, fat, and muscle. So there's some laxity of the skin with some stretch marks typically, some laxity of the muscle or the fibrous layer over the muscle, and sometimes some excess fat we have to deal with. Some patients who come in do have good skin still. The skin elasticity is good and the muscle layer is good. And in those patients we do just liposuction, taking away excess skin, allowing for the skin to shrink up. But most of those patients require a more elaborate procedure. We have to deal with the loose skin, deal with the laxity of the muscle, then we do various kinds of abdominoplasties or tummy tucks. So when we decide the patient in need and we decide that an abdominoplasty is the best procedure, the goal of the operation is to reduce excess skin. So there's a very long incision that runs along the waistline. And also we go in and tighten up the muscle layers. So once the incision's made, I can look in there. We put special stitches in that reinforce that muscle layer to tighten it in nice and flat, take away the excess skin, trim it, and then stitch it up.
What are the recovery considerations with a mommy makeover?
Most patients who have a breast augmentation and most patients who have a tummy tuck will go home that evening. The procedures are done as an outpatient. Combining them, I think, is a little tough, though. There's some fair amount of discomfort. The patients are bent over at the waist for the first little while. And what's really nice is that my practice is here at Swedish Hospital. We're attached to the hospital, and we regularly will admit patients who have a combination of breast and abdominoplasty procedure to the hospital overnight. They can get a little better pain control, any nausea control which may be necessary. Just a nice addition to the practice. We can take care of these patients nicely.